Hey, Mom Nation, we are back with another Live and Learn. I absolutely love Live and Learns because this is my opportunity to spend a little bit of time with our amazing mama members and learn something. So today we're going to do just that. And we are going to talk with Lina from Lina. Oh my gosh, my notes, where are they? There it is. Pure Life Chiropractic. I'm so sorry. I just know you as Lina. So my apologies on that. But Lina's located in the Scottsdale area. Her practice's name is Pure Life Chiropractic. And we are going to talk a little bit about chiropractic and pregnant mamas today.
Yes, we sure are.
Awesome. Tell me a little bit about you, just real quick. How did you get started? What's your passion? Tell us a little bit about your practice.
So we opened up here in Scottsdale at the end of 2017. So we're about to celebrate our 5th birthday at the end of this. It went by extremely fast, but at the same time, it feels like we've been here forever, which is kind of crazy. But I specifically only see pregnant moms, so prenatal care, as well as pediatrics, so newborns. And yeah, they're just my my passion, just because, for one, with the pregnant moms, a lot of people assume that a lot of people don't know that you should get chiropractic throughout your pregnancy, but when they think of it, it's often because they have a low back issue or sciatica or something like that.
Yeah.
True purpose or benefit of chiropractic in pregnancy is to actually help you have an easier labor and delivery, and who wouldn't want that, right?
Yeah, no kidding.
We'll talk a little bit about that. And I guess, to me, I love the preventative aspect of treating babies and pregnant moms, where you're helping them keep things as healthy as possible for a great outcome, versus somebody coming in when they already have all these different symptoms and issues, and now you're trying to fix them. So I think that's what attracted me the most to that population, is helping like babies thrive and become healthy adults, and then helping pregnant moms have the best possible birth for them.
That's awesome. And who doesn't want to work with babies? I mean,
right.
So I don't blame you at all on that. Can you give us some, maybe some examples on how you've helped pregnant mamas in the past, or like what, if you could pick top 3 things that you would want every pregnant mom to know about chiropractic care, what would that be?
So, okay, so just in a nutshell, to explain why chiropractic helps with birth, I have my little pelvic model.
Nice.
So essentially, this is where the babies are going to exit from. So you can imagine, just very simply put, if your pelvis is imbalanced, if you have a dysfunction one way or the other, this is how the pelvis moves. So if you have an imbalance, you can see how it is going to create a lot more difficulty in that passage for the baby to come out. So already, just to, I guess, define the technique that we use, it's called Webster's for pregnant moms. The main goal is to bring back balance into the pelvis so that moms are feeling their best and functioning their best for an easier labor and delivery. So the first thing that we check is going to be the sacrum, which is that bone all the way at the bottom of the low back. If the sacrum, so I'll show you the top view here, if this bone misaligns, it can move this way or this way, and it literally infringes on the space that the baby has to be in inside the uterus. And so goal number 1 is adjusting the sacrum to create as much space for the baby as possible for them to get into the most ideal position for them. So our bodies, our babies, that we have what we call innate intelligence. So they will get into the most ideal position, which, hopefully is going to be head down. And we want that for the ideal birth. So creating space for the baby is going to be important. And then the other part about the sacral adjustment is that you have nerves coming out from every level of your sacrum, and these nerves are traveling to not only all the muscles of your low back, into the glutes, down into the legs. So if there's a sacral misalignment, it's going to cause a lot of pressure on those nerves, which can lead to low back aches and pains, sciatica symptoms. So we want to get that pressure off so that the mom is feeling good. But the other part of it, which is even more important, is that those nerves are also supplying the digestive system, the reproductive system, and the urinary system. So within that reproductive system, those nerves are going straight into the uterus, and the uterus is kind of like a big muscle. We want those nerves to be able to properly communicate messages to your uterus to tell it when to contract, how hard to contract, to have an easier labor and delivery. So that's the other big part of why we want to get pressure off of that low back area. The nerves are in that low back because they're supplying our uterus. And then the other parts of the Webster technique that we add on are releasing all the soft tissues and ligaments that are supporting the pelvis. So we work on releasing the sacrotuberous ligament, which is down here. You can see if it tightens up, it can cause that imbalance again in that pelvic structure. We work on releasing the hip flexors in the front. So because most of us, unfortunately, we just sit all day long, or for the majority of our day, they're actually tight in most people. So having that belly growing there, they're even more tight. So we release those. And then we also work on the round ligament as well. So all of that put together is what is the Webster's technique, which allows us to restore balance into the pelvis to improve function and feeling and to prep for labor and delivery.
That's huge, I feel like, because, well, obviously you explained it extremely well, and thank you for the visual, because that it's really helpful when you do this every day so you can visualize it, but for us it's hard. So thank you for providing that. I had no idea. Like, I'm going to seriously be 43 years old in a little more than a week, and I have never heard what you just said ever in my life. And I've had a baby, and they don't teach you that.
I know, it's really crazy. The majority of moms that know about this coming into the office are moms typically that have had such a bad experience in their first birth that they had to kind of like dig deep and look into, okay, what can I do to have a different experience for my second birth? And then they find these types of resources. I wish it was more available. In our office, we try to educate all of our patients, whether they're pregnant or not, on the benefits of chiropractic for babies, for pregnant moms, for anyone and everyone, just so that if they know somebody in their family circle or friend circles, so that they're able to give that suggestion or that advice, because if you don't know, you don't know, but the more resources you have, the more options, then you'll be able to try.
Absolutely. And that's giant. So if one of these huge bones is in the way, obviously that's going to be painful for the mom, and who knows what's going on for the kid in there, right? So like, what's the experience for them?
That's exactly it. So the more pressure you can get off of, there's like the two perspectives. The one perspective of you're getting pressure off the mom's nervous system. So of course, mom is going to be very positively affected by that. You're always better off with no pressure on your nerves than with pressure on your nerves. Baby's going to be positively affected by that because they're kind of, everything that they're getting is supplied by the mom. And then there's also the structural part of it. So the pelvis as a structure, if it's off or out, then the mom's going to be uncomfortable. And if it's off or out, then baby's also going to be in a more tight or squished environment. So it'll affect them and their development to some point as well. So it's really just, I'm very biased, but in my opinion, who wouldn't want to set themselves up in this most ideal way possible before giving birth,
Yeah, exactly. And those big bones that you showed, I know it was missing the spine that needs to come up from there, but that's a big deal. Like, that's everything. If you think about it, and you're the doc, your spine is like, it holds everything.
Your spine holds your spinal cord, and your spinal cord is your central nervous system. And that central nervous system is what's controlling and coordinating every single function in your body. So your heart, your lungs, your digestive system, every organ you can think of, it's doing what it's doing because your nerves are telling it to, and your nerves are stemming from your spine. So if you have a bad structure, if you don't take care of the health of your spine the way that you ideally should, it will affect your health in general, because that's where it's starting. That's where it's coming from.
Totally agree. And I think not a lot of people are privy to that. So I've heard, sometimes moms are a little bit shy to get chiropractic care during pregnancy because they're worried maybe it's going to hurt the baby or, something like that. So can you speak to that and kind of let us know, what is it like day in the life of a pregnant lady that comes into your office? Like, what is an adjustment like? And can you sort of dispel those fears of hurting the baby?
So the actual position that the mom will be in is essentially the tables that we have, they allow room for the pregnant belly. So the piece on the abdomen, it drops. And then we also have pregnancy pillows that are specifically made to fit around the belly. So most moms, because they haven't laid on their stomachs throughout their whole pregnancy, they feel so good when they're able to just lay face down for those few minutes.
Yeah.
And the adjustment itself, it's very gentle. We're not doing any rotation. We're not doing any twisting, major cracking, anything like that. It's very gentle. It can feel sometimes like trigger point therapy when we're releasing the ligaments. So it would be like getting a prenatal massage, or it would be like any one of those other things. It's not more aggressive or anything like that.
That's really good to know. And do you usually have any sort of exercises that you suggest that moms do to strengthen the muscles? So, because I can imagine, and again, you're the doc, so stop me if I'm wrong, but I can imagine that if bones are kind of out of whack for a good amount of time, and then you start putting them back into place, your muscles probably aren't strong enough to hold them back into place, right? And so, you know where I'm going with this. Do you have any sort of suggestions to help moms keep their adjustments longer?
So pregnancy is a little bit more of a tough one. So of course you always, whoever you are, pregnant or not, you always want to be paying attention to your biomechanics. So how you sit, how you stand, how you get in and out of a car, what positions do you sleep in? You want to make sure that you're active enough. So you're not sedentary. Essentially, you're moving enough to keep fluid pumping into the joints and all of that. But with pregnant moms, it is a little bit tougher because as time passes, the belly is growing. And as the belly is growing and the baby's developing, more stress is on the body, more stress is on the spine. So really the way that we look at it is we try our best to maintain and balance things out as much as we can throughout the pregnancy. And then once the mom delivers and has the baby, then we start fresh with a recovery where now we can really do a proper analysis on that pelvis, see what it looks like. In our office, we focus a lot on the pelvis just because it is the foundation of the rest of the spine, structurally speaking. Mm-hmm. So if you have any imbalances at the base, it's going to affect everything the rest of the way up. And no matter what you're doing to treat the top, if it's compensating for a bad foundation, it's just going to keep coming back. So it's really after the delivery that we focus a lot on structurally rebalancing the pelvis, and the way that you allow it to hold for longer and longer. It's going to be, one, you have to be consistent because misalignment is kind of like a sprained strain. So when the joint moves out of proper position, once you're readjusting it, you want to be consistent with the adjustment for enough time to allow the ligaments and the muscles that are supporting that joint to start healing and holding it in that position. So now you're almost causing it to reset, while at the same time paying attention to your posture. That's such a big one because unfortunately everything we do is paying attention to posture, and then paying attention to our biomechanics, and then working on stretching what needs to be stretched, strengthening what needs to be strengthened. And in most people, these muscles here are the ones that tend to be the shorter ones that need to be stretched out because we need to be in a more opened up position. And then the postural muscles on the backside need to be strengthened to hold us in a better spot. That's just an example, but that's kind of where we focus a lot more on, that is during the recovery after birth. Mm-hmm. Yeah.
So important. What about are there any sort of stretches during pregnancy that you suggest that a mama would do to sort of relieve the back pain and give her a little bit of relief because, it's heavy.
So the main two that we always are going after and trying to release are the piriformis muscle, which is in the glute. So think like pigeon pose in yoga, or like a figure four where you put your ankle on your knee and you're hinging forward. And the other one is the hip flexors. So any lunge variation where you're have the one leg back and you're just trying to open up in that front of the hip. Those two are the main two that are gonna really tighten up as the baby's growing more and more, that we try to keep as relaxed and released as possible.
Do you suggest, and maybe it's different for everybody, but what's the frequency that you typically suggest for your mamas to come in?
If a mom does not have any symptoms, if she's asymptomatic, she's just coming in for wellness throughout her pregnancy, then we can get away with doing once a week. A month before labor and delivery, we up it to 2 times a week. If somebody does have a lot of symptoms going on, whether it's sciatica or low back aches and pains or whatever it may be, then we might start them off at twice a week at the beginning. But just generally speaking, once a week as the belly is growing, each week is a good maintenance frequency. And then the month before, we'll up it to twice.
Good to know. Good to know. Anything else that you'd like to add about our pregnant mamas and chiropractic care?
I would just say there's so much information out there on the ICPA website, the International Chiropractic Pediatric Association has a lot of info on Webster's, the pregnancy technique, and on kiddos and adjustments and the benefits there. We also have a lot of information on our website, which is purelifeaz.com. And we also share a lot of resources and information on our Instagram page, which is Pure Life AZ. So those are all resources to go look into. And then we're more than happy to answer questions if anybody has any and they want to reach out.
Awesome. And I have your Facebook page linked in the show notes too. So that's there, easy and clickable. What about a phone number for the office in case somebody likes to do the old fashioned phone call thing?
So the office number is 480-744-6565.
Awesome. And again, that's Pure Life Chiropractic in Scottsdale. What are your cross streets?
We're actually right off the 101 and Talking Stick. So if everybody knows the casino, that's our across the freeway from the casino, there's a Pavilion Shopping Center. And there's 4 big parking lots. We're in the same parking lot as Home Depot and Conn's.
Awesome. So that is for our local AZ moms. That is where Lina is located. Do you have any suggestions for our mamas that aren't local to Scottsdale? Maybe they're in other parts of Arizona or even other parts of the country.
So I do know that on the ICPA website, they list providers who are certified in the Webster's technique for pregnant moms. So they could always go on that website and put their zip code or whatever it may be, and it'll pull up a list of who's closest or nearest them.
Awesome. Good to know. All right, Doc. Well, thank you so much for spending a little bit of time with me today. It was awesome.
Thank you for having me.
All right. Bye.
Bye.